In this video, our subject is bed making. We will discuss getting ready, an introduction to bed linens, how to handle bed linens, how to remove soiled linens, how to miter corners, fan fold, and make toe pleats, how to make an unoccupied bed, how to make an occupied bed, how to prepare a surgical bed, and finishing up. As nursing assistants, we sometimes forget that everything we do has an impact on the health care we provide. And I'm not just talking about obvious tasks, such as those related to infection control or keeping our patients or residents safe. Sometimes it's the little things that can mean the most and make our patients or residents the happiest and healthiest. Take bed making, for example. Clean linens protect against odor and infection, and a properly prepared bed can help prevent skin breakdown and pressure ulcers. So, proper bed making skills provide comfort and foster good health. Those who are in our care often spend a great deal of time in bed, so beds that are comfortable and welcoming contribute greatly to their peace of mind, and that, in itself, is an important part of quality health care. Preparation, that is getting ready to manage your work in a manner that is safe, healthful, and efficient, is key to successful health care. No matter what tasks you'll be performing during your shift, whether those tasks are planned or unanticipated, you will benefit from a routine of careful preparation. Begin each interaction with patients or residents by performing these steps. Wash your hands. Gather all needed supplies. Knock before entering the person's room. Introduce yourself using your name and title and greet the person by name, remembering that a friendly greeting helps establish rapport. Carefully identify the person adhering to your facility's approved method. Explain to the person the procedure you're about to perform and make sure the person understands before you begin. If necessary, show visitors where they can wait outside the room. Provide privacy by closing the door and curtain. As appropriate, drape the person for modesty. And then, throughout the procedure, see to safety using proper body mechanics and following all safety precautions for equipment use and infection control. Let's begin by introducing the linens you will be using in your daily bed-making routine. A mattress pad is a thick layer of padding that is placed on the mattress to help make the bed more comfortable. The mattress pad also protects the mattress from moisture and soiling. Sheets used in bed making must be clean and wrinkle-free. The bottom sheet can either be flat or fitted. When you are using a flat sheet as the bottom sheet, it is important to tuck the sheet tightly so that movement does not cause the sheet to loosen and wrinkle underneath the person, because wrinkles can lead to skin breakdown. A draw sheet is a small flat sheet that is placed over the middle of the bottom sheet, covering the area of the bed from slightly above the person's shoulders to about mid-thigh. The draw sheet may be used instead of a mattress pad to form a protective, moisture-absorbing barrier between the person and the mattress. The sides of the draw sheet are usually tucked tightly under the mattress to prevent wrinkling. Sometimes, draw sheets are used to assist with turning or lifting a person. When a draw sheet is used for this purpose, it's called a lift sheet. A bed protector is a square of quilted, absorbent, fabric-backed waterproof material placed directly under the person, either on top of the bottom sheet or on top of the draw sheet. The bed protector may be disposable or may be laundered and reused. It is helpful to use bed protectors when a person is incontinent or has a draining wound. The urine, feces, or wound drainage is pulled away from the person's body by the absorbent layers of the bed protector, and the bottommost waterproof layer keeps the liquid from soiling the rest of the linens. As seen here, the top sheet is a flat sheet. Blankets are usually of woven cotton and should be available whenever requested by patients or residents for their comfort. A bedspread adds the finishing touch to a well-made bed and contributes a decorative touch to a person's room. In long-term care facilities, people are encouraged to use their bedspreads from home. This practice helps to foster a sense of independence and individuality. Pillows are made from a wide variety of materials and are always covered with clean pillowcases. In addition to their customary use as a support for the head and neck, pillows are also used to help position patients and residents. A bath blanket is a soft, thin cotton blanket. A bath blanket may be used when changing linens on an occupied bed to cover the person and provide privacy. Bath blankets may also be used to provide privacy during a bed bath. Collecting the linens for bed making requires taking certain precautions as well as following special steps. First, as we stress so often, wash your hands. Then, as you collect the clean linens prior to making the bed, make sure you reduce the spread of infection by keeping the clean linens from coming into contact with dirty surfaces such as your uniform. You should always collect the linens in the order they'll be used, pretty much from the bottom up. Be sure to collect only those items of linen that you will need for that person's bed. This might mean that you start with a mattress pad, then a bottom sheet, draw sheet, top sheet, blanket, bedspread, and finally, pillowcases. Extra linens brought into a person's room must not be returned to the linen cart, as they are considered contaminated by any germs that may be in that room. Once you've made your stack of linens, flip it over so that the item you need first is now at the top of the stack. By having the linens arranged in order, you'll be able to make the bed without searching through the stack for the next linen you need. Before making a bed, be sure to follow the standard getting ready steps, including washing your hands. The supplies you'll need to gather most likely will include gloves, bath blanket, mattress pad, bottom sheet, draw sheet, bed protector as necessary, top sheet, blanket, bedspread, and pillowcase. Begin the bed making by placing the clean linens on a clean, dry surface close to the bed, perhaps on the overbed or bedside table. For good body mechanics and back safety, position the bed at a comfortable working height. Then make sure the wheels are locked for safety. Before putting on clean linens, you will first need to remove soiled linens from the bed. When doing so, keep in mind the following key points. Always wear gloves. Place soiled linens directly into the soiled linen bag in the room or into the linen hamper according to the policies of your facility. Never place soiled linens onto the floor or hold them against your uniform. Always roll soiled linens toward the center of the bed, keeping the soiled area on the inside. If body fluids have leaked through the linens onto the mattress, thoroughly wipe down the mattress with an appropriate cleaning solution and make sure it is dry before you place clean linens on the bed. Begin by putting on your gloves. Remove the call light control. Next, lower the side rails. Remove the pillow from the bed. Grasp the pillow with one hand and remove the pillowcase with the other. Place the pillow on a clean surface and place the pillowcase on the center of the bed. Note that bedspreads are not usually changed as often as other linens unless they are soiled. If the bedspread is to be used again, place it over the back of the chair. Be sure to check the linens for items such as glasses, dentures, jewelry, and even supplies used by your coworkers such as syringes. Loosen the corners of the linens by untucking them from the mattress corners. Then roll the linens toward the center of the bed. Remember to avoid contact between your uniform and the dirty linens. If the mattress is wet, be sure to clean it with the appropriate solution approved by your facility and dry thoroughly with paper towels before applying clean linen. Before proceeding with putting clean linens on the bed, remove the dirty linens from the room and take them to the area designated by your facility. Remove your soiled gloves and wash your hands. Put on a new pair of gloves if necessary before handling the clean linens. To make a bed properly, you will need to learn a number of specialized skills, including how to make a mitered corner. Mitering is a way of folding and tucking the sheet so that it lies flat and neat against the mattress. When a flat sheet is used as the bottom sheet, as shown here, the mitered corners are made at the top of the bed to help secure the sheet to the mattress. Mitered corners are made at the foot of the bed to hold the top sheet, blanket, and bedspread in place. To miter a corner, grasp the edge of the sheet about 12 inches from the head of the bed, and smooth the hanging portion of the sheet against the side of the mattress. Then, tuck the hanging portion of the sheet underneath the mattress while holding the triangular fold taut against the top of the bed. Now, bring the triangular fold back down over the edge of the mattress and tuck it underneath. Next, working from the head of the bed to the foot, tuck the near side of the sheet under the mattress. Smooth out any wrinkles and make sure the mattress pad remains in place. Many skills you'll perform call for fan folding the linen. This is a way of folding the linens so they can be drawn easily over a person. To fan fold, grasp the center of the top linens and draw them down toward the foot of the bed. Keep drawing them past the foot of the bed, then reverse direction and fold them back toward the head of the bed. Repeat these steps a few more times as demonstrated here, ending up with the edge of the covers smoothed at the foot of the bed. With this completed fan fold, your patient or resident need only grasp and pull, and the covers will unfold. Another technique to provide comfort for a patient or resident in bed is called a toe pleat. A toe pleat reduces the amount of pressure that bed linens place on a person's feet or toes. To make a toe pleat, simply grasp the blanket and top sheet where they cover the person's feet. Pull them gently upward toward the ceiling. This makes a pleat in the covers and reduces pressure below. Once you have removed soiled linens, you are ready to make the unoccupied bed. As demonstrated earlier, begin the bed making by placing the clean linens on a clean, dry surface close to the bed. Position the bed at a comfortable working height, then make sure the wheels are locked for safety. Begin by ensuring that the mattress is aligned with the head of the bed. Unfold the mattress pad on the bed so that the vertical crease is centered on the mattress. Then line up the top of the pad with the head of the mattress. Then open the remainder of the mattress pad across the bed. Next, put the bottom sheet on the bed. If it is fitted, pull down the near side corners. If the sheet is not fitted, unfold it with the wide hem at the head of the bed and with the hem stitching facing down, against the mattress and away from the person's skin. Position the vertical crease down the center of the mattress. Then, open the sheet across the bed. The same length of the sheet should hang over each side of the bed, and the lower edge should be even with the bottom of the mattress. Tuck the sheet under the mattress at the head of the bed and miter the corner. Then, tuck the near side of the sheet underneath the mattress, working from the head of the bed toward the foot. As you tuck, make sure there are no wrinkles in the sheet and that the mattress pad remains smooth and in place. Then, put the draw sheet on the bed, with the top at about 12 inches from the head of the mattress. If you're using a plastic or rubberized draw sheet, always put a cotton draw sheet on top. Smooth the draw sheet across the top of the bed and tuck the near side under the mattress. Now move to the other side of the bed and repeat the steps of aligning the mattress pad, mitering the corner, and tucking in the bottom and draw sheets. Next, unfold the top sheet with the wide hem at the head of the bed, and since this is the top sheet, with the stitching facing up, away from the person's skin. Unfold the top sheet so that only one vertical crease remains and is centered on the mattress. Now, open the sheet across the bed so that the same length hangs over on both sides. Line up the top edge of the sheet with the head of the mattress. Then, pull the bottom of the sheet over the foot of the bed, leaving it untucked for now. Then, unfold the blanket on the bed, much as you did the sheet. Center the vertical crease, open the blanket, and make sure the same length hangs over both sides. Unlike the top edge of the top sheet, the top of the blanket should be positioned 6 to 8 inches below the head of the mattress. Then fold back the top edge of the sheet to make a cuff approximately 6 inches wide. Make sure the bottom edge of the blanket is over the sheet at the foot of the bed. Leave the blanket untucked. Now, unfold the bedspread like you did the sheet and the blanket, centering the crease on the bed. Open the bedspread across the bed and make sure the sides hang over sufficiently to cover all of the other bed linens. Line up the top of the bedspread with the head of the mattress. You can add more length at the top if you'll be tucking the pillow under the bedspread. Make sure the bottom of the bedspread covers the blanket and sheet at the foot of the bed. You'll tuck the bedspread, blanket, and top sheet together under the foot of the mattress. Miter the corner on both sides of the foot of the bed. Fold the top of the bedspread back over the blanket to make a cuff. Finally, rest the pillow on the bed. Grasp the pillowcase by its closed end and turn it inside out over your hand and arm. With this covered hand, grasp the pillow. Then pull the pillowcase down over it using your free hand. Make sure any tags or zippers are inside the pillowcase. Place the pillow on the bed. To ensure a neat and tidy appearance, make sure you place it with the open end of the pillowcase facing away from the door. Then complete your finishing up steps as described in the final section of this video. Some conditions make it difficult or impossible for a person to get out of bed for a linen change. In such cases, it is necessary to change the linens while the person is still in the bed. This is called making an occupied bed. You will prepare for making an occupied bed in much the same way that you prepare for making an unoccupied bed. Be sure to wear gloves when making an occupied bed because the possibility always exists that you might come in contact with blood or body fluids. Lower the head of the bed to horizontal or as close to it as the patient or resident can tolerate. Check with the nurse if you are unsure if the person can tolerate this position. For example, if the person is on aspiration precautions, the head of the bed should not be lowered. Remove the bedspread and blanket from the bed. If you're going to reuse them, fold them and place them on a clean surface. Loosen the top sheet from the foot of the bed. Spread a bath blanket over the top sheet.
Okay.
This will enable you to remove the top sheet without exposing the person. The person can either hold the bath blanket in place, or you can tuck the corners underneath the person's shoulders. Pull the top sheet out from underneath the bath blanket and place it in the soiled linen bag. Lower the side rail on the working side of the bed while making sure the side rail is up on the other side. Turn the person on her side facing away from you. Reposition the pillow for comfort and drape the bath blanket for cover. Loosen the draw sheet, the bottom sheet, and if necessary, the mattress pad. Fan fold the linens toward the person's back, tucking them slightly beneath the person. If you're not changing the mattress pad because it's dry and not soiled, for example, just straighten it. If you are changing it, as demonstrated here, place the clean mattress pad on the bed and center the vertical crease on the mattress. Unfold the pad, then make sure its top is lined up with the head of the mattress. Fan fold the mattress pad close to the patient or resident. Next, put the clean bottom sheet on the bed. Unfold the sheet so that one vertical crease remains and is centered on the bed. If the sheet is not fitted, place it so that when you unfold it, the wide hem will be at the head of the bed and the hem stitching will be facing down against the mattress and away from the person's skin. Fan fold the opposite side of the sheet close to the patient or resident. Tuck the sheet under the mattress at the head of the bed and miter the corner as demonstrated earlier. As you work from the head of the bed to the foot, tuck the near side of the sheet underneath the mattress, smoothing wrinkles and making sure the mattress pad stays put. If the bottom sheet is fitted, pull down the corners and smooth the side. Next, place the draw sheet on the bed so its top is about 12 inches below the head of the mattress. If you're using a plastic or rubberized draw sheet, put a cotton sheet over top of the draw sheet so that the same length of the cotton sheet hangs over both sides. Fan fold the opposite side close to the patient or resident. Smooth the draw sheet across the bed and tuck the near side under the mattress. In preparation for moving to the opposite side of the bed, raise the side rail on the side of the bed you've been working on. Help the person roll toward you over the fan-folded linens. Reposition the pillow and bath blanket. Leaving the person lying on her side, move to the opposite side of the bed and lower the side rail so as to give yourself better access. Now you can loosen and remove the soiled bottom linens and place them in the soiled linen bag. Now change your gloves. Then repeat the process of aligning the mattress pad, mitering the corner of the bottom sheet, and tucking in the bottom sheet and draw sheet. Be sure to smooth out any wrinkles that would come in contact with the person, as these can lead to skin breakdown. Help the person roll back to the center of the bed and make sure she is comfortable. Raise the side rail. Change the pillowcase. Remember, if the pillowcase is soiled with blood or other body fluids, you will need to change your gloves after removing the dirty pillowcase and before handling the clean one. Grasp the clean pillowcase by its closed end and turn it inside out over your hand and arm. With this covered hand, grasp the pillow and with your free hand, pull the pillowcase down over it. Make sure any tags or zippers are inside the pillowcase. Place the pillow under the person's head with the open end of the pillowcase facing away from the door. Next, open the clean top sheet over the person and the bath blanket she is still covered with. The wide hem goes at the top of the bed with the hem stitching facing upward away from the person occupying the bed. Avoid covering the person's face. Unfold the sheet so that only one vertical crease remains and is centered on the bed. Open the sheet across the bed so that the same length of sheet hangs over both sides. Then, with the person either holding the top sheet or with the sheet tucked underneath the person's shoulders, remove the bath blanket by pulling it from underneath the top sheet. Put the bath blanket in the soiled linen bag. Unfold the blanket, then the bedspread over the top sheet. Position them about 6 inches below the top edge of the sheet so that you can create a cuff. Tuck the bedspread, blanket, and top sheet together under the foot of the mattress. Miter both corners at the foot of the bed. Make a toe pleat to ensure that the person has room to move her feet without undue pressure. To complete this procedure, gather any soiled garments and linens and place them in the soiled linen hamper. Remove your gloves. Wash your hands. Then, complete your finishing up steps as described in the final section of this video. You may also be asked to prepare a surgical bed, which is a bed specially prepared to receive someone who is returning from a diagnostic or surgical procedure. Properly prepared, the surgical bed allows an easier transfer from stretcher to bed. As always, start with your getting ready steps, including hand washing. For safety, position the bed at a comfortable working height. Then, make sure the wheels are locked. Instead of opening the bed by fan folding the top linens to the foot of the bed, untuck the top sheet, blanket, and bedspread from the foot of the bed. Fold the top linens toward the head of the bed so that the fold is along the bottom edge of the bed. Then, fold the top linens to the side. This will make the transfer from stretcher to surgical bed easier. Now, raise the bed to a height that will be about the same height as or slightly lower than the stretcher. Finally, make sure the furniture in the room is positioned out of the way so that the stretcher can be brought into the room and easily positioned next to the bed. When you have finished with a procedure, always follow a routine of finishing up to ensure your patients or residents' safety and comfort. First, confirm comfort and good body alignment, whether the person is seated or in a bed. Leave the person's call light control within easy reach, and do the same for any other items the person may want, such as remote control devices, the telephone, or fresh water. Next, see to safety. If appropriate, return the bed to its lowest position. Then, make sure the wheels are locked for safety, and place the side rails in ordered or requested positions. If desired, open the curtain or door and ask whether the person would like for visitors to return. If you use gloves, first discard them according to your facility's policy. Then, wash your hands. Finally, report and record all pertinent information about the procedure, including the date and time of the procedure and your full name and title.